How do you evaluate and manage a rash in a patient with a gastrointestinal cancer who is receiving immune checkpoint inhibitor therapy? What are the possible causes? Rash is one of several potential immune-mediated adverse events that can occur from immunotherapy. In patients with a GI cancer receiving immunotherapy, if they do develop a rash, it's very important for them to notify the provider. If they're within a distance, if it's a long way for them to get to the office, the provider may even want them to send pictures. But also, we tell our patients to take pictures to bring to us because, inevitably, the minute you make the appointment and get to your provider, the rash has miraculously gotten better. So it's nice to have the rashes documented. The rash that develops from immunotherapy, single agent immunotherapy, it's usually pretty mild. It can be kind of a red blotchy rash, and it tends to affect the arms, the trunk, and the legs. Usually we don't see a severe rash involving the face. In most instances with immune rashes, that is. But again, reporting it is very, very important and making sure it is evaluated by the provider if need be. Usually what we'll do with our patients is we'll recommend that they start topical therapies, which means therapies such as creams that the patient can apply. We'll recommend topical steroids, for instance, such as hydrocortisone creams. Also, if the rash is itching, we may recommend a topical anti-itch cream, such as a Benadryl cream, or we can even sometimes recommend that the patient take an oral Benadryl if the rash is itching or bothersome enough. However, if a patient does have a pretty cumbersome moderate rash that isn't responding to topical therapy or a severe rash, in those situations, we will need to use oral steroids. We'll usually use prednisone 0.5 up to 2 milligrams per kilogram per day. And then, of course, watch to make sure the rash does respond well and improve once the steroids have been initiated. Once the rash has improved, then we will start a slow steroid taper over a 1 month period. Of course, the immunotherapy will be held during that time. And then after the patient's tapered off the steroids, in most cases, we will consider re-challenging the patient with immunotherapy. However, there may be some circumstances in which we will need to permanently discontinue immunotherapy for a severe rash or a rash that hasn't responded well to steroids. There are a few reported cases where patients have developed severe, even life-threatening type of rashes. It's very rare that that happens. It's usually on combination immunotherapy. But if you do develop a rash that is covering a large part of your body area, looks almost more like burns, in those cases, you should report to the emergency room and not wait to get in to be evaluated by your provider.